Did you know that 1 in 8 women has certain reproductive health issues, some of which can affect her ability to conceive? Fertility surgery may be an option. Dr. Jeremy Groll joins me now with more. Welcome back.
Thanks, Katie. And so, yeah, and especially here at the end of the year or beginning of the year, for people who may be looking at elective surgery, that they've either met their deductibles with their insurance, or if they haven't, going into the new year, they can establish that right away.
Sure.
So would be a great time for them to actually explore those options. And so a lot of women may think, like with fertility treatments, that it's a lot of hormonal treatments or expensive things like in vitro fertilization, but many things can be fixed simply with surgery, or if there's particular problems, that we can address that in a variety of minimally invasive ways.
I know some of those blocked fallopian tubes, endometriosis, fibroids, just to name a few.
Absolutely. And so these are all things that we would be able to evaluate through their initial testing, whether it's through x-rays or ultrasounds, or through different laboratory tests that we're able to assess their fertility potential. And then if they are candidates for potential surgeries, that could be a real good way for various people to improve their chances.
Okay. I know one of the things that you wanted to touch on today was MyoSure. Tell us what that is and how it can help.
So that is a device that we use actually with something called a hysteroscopy.
And we're seeing a photo of it now.
Yes, and so basically this is to help address things that are on the inside of the uterus. So sometimes we may have polyps or fibroids that prevent the baby from attaching properly.
Okay.
That could either cause delay or with risk for miscarriage.
Sure.
And this MyoSure device is increased the safety of these procedures because it does not use electricity, so it has a much lower complication rate, and it's very fast. So these procedures oftentimes take under a minute to remove the lesion. And so it's very effective and very safe, and so has really advanced our ability to help some of these problems.
Yeah, short recovery time too, as you saw on your screen there. Now, you were telling me MyoSure is actually kind of a part of a hysterectomy, but we have some information on that, kind of what a hysterectomy does.
Or a hysteroscopy.
Hysteroscopy, sorry.
We want to keep the uterus
Let's do that.
of the pregnancy. But with that, yes, we're able to actually go through the cervix. So this has no cuts on the tummy, and so that minimizing their recovery. So oftentimes, by the time the anesthesia is worn off, some minimal menstrual cramps or a little bit of bleeding, and that's it. And most people are back to work within a day or a couple days, back to their regular routine. And that with that device, we can go in and visualize the inside of the cavity and remove fibroids, and also some people may be born with something called a septum that is basically a fibrous band, and we can actually take that out as well. So really gives us some great options. Aside from the MyoSure, we can also look through the belly button, and so that's something called a laparoscopy.
Okay.
And as you mentioned, that we could either take down scar tissue or some diseases like endometriosis, which has a lot of inflammation associated with it. So removal of that disease can accelerate the time to pregnancy, and that with this, it allows for not only better opportunity for the egg to be taken into the tube, but can cut down inflammation and lead to a better environment for that egg to mature.
Excellent. I had endometriosis and had a laparoscopy as well. If you are considering one of those surgeries, you could go see Dr. Jeremy Groll if you're interested. He's there in Centerville, SpringCreekFertility.com. Always great to have you on the show.
Great.
Thank you so much,
Kate.
and happy holidays to you.
Same to you.